a bill that would let psychologists prescribe medication passed in the legislature. It's now being reviewed by the governor. Jacqueline Duke joins me now from Chicago. She's a clinical psychologist who works primarily with autism patients. Jacqueline, welcome. Thank you for being with us.
Thank you for having me.
Oh, okay, so I can hear critics saying in my head, we already have enough medication. Why do we need to make it easier for people to get medication? What do you say?
Well, really what this bill speaks to is the critical shortage of mental health practitioners that can prescribe psychotropic medications in the state of Illinois. Right now, there's about one psychiatrist per 1,500 Illinois citizens that are in need of mental health medications. A lot of people are thus falling through the cracks. And what this bill allows is it gives currently licensed doctors, clinical psychologists such as myself, to the opportunity to pursue additional training, extensive, rigorous training and experience to gain that expertise in psychopharmaceuticals.
So in Illinois, what does this mean practically? If people can't get the medication they need, what happens?
Well, if people cannot get the medication they need, they just frankly go untreated, and therefore their psychological conditions can get worse, and that's where we see violence and other crimes.
Is there a danger, though, of overprescribing drugs? I mean, isn't this a country that has been overprescribing psychotropic drugs or not?
Absolutely, absolutely. But the current bill, as it reads now, has some limitations. So prescribing psychologists are limited in that they cannot prescribe benzodiazepines or narcotics or other types of drugs that are high risk for addiction or reliance. And therefore, we're going to rely more on the psychotherapeutic interventions for those types of conditions such as ADHD and anxiety.
So psychiatrists are the only ones that can prescribe this sort of medication because they're doctors. But are there just too few psychiatrists out there? Is that it?
Absolutely. There's a huge shortage, especially in Illinois right now, in those underserved populations.
So give me a sense, how rigorous is this training that psychologists would have to go through?
Sure. Well, you have to already be a licensed clinical psychologist. And what that entails is a master's in clinical psychology, plus about 3 years of coursework, 1,500 hours of practicum experience, a full year of internship, an accepted doctoral dissertation, then a full year of postdoc, and then passing a state licensing exam. At that point, then you can start. And this program would be almost an additional 2 years of coursework, plus about 500 hours of supervised practicing, and then a national state exam to pass. So as you can see, it's quite intense.
Are there professional organizations that support this legislation?
Well, right now, a very active organization is the Illinois Psychological Association that helped collaborate on this bill and push it as far as it's gone so far.
AMA, others, have they weighed in?
Absolutely. It was a collaborative effort with the American Psychiatric Association, the American Psychological Association, the Illinois Nurses Association, and the Illinois Medical Society.
Well, we'll see what happens in Illinois. Jacqueline Duke, it's good to have you in the program. Thank you very much.
Thank you.